Fatty liver occurs when excess fat accumulates in the liver. While a certain amount of fat in the liver is normal, an excessive buildup can pose health risks. It's crucial to understand that fatty liver can cause lasting liver damage. However, the good news is that it is reversible with timely and proper care. Now, let's explore some straightforward steps you can take to safeguard your liver. First, let's delve into the stages of disease progression to provide you with a clear understanding of where intervention can reverse the disease. In this video, our primary focus will be on non-alcoholic fatty liver disease, which can advance through 4 distinct stages. The initial stage is known as simple fatty liver, characterized by the accumulation of excess fat in the liver. Simple fatty liver is generally benign unless it advances further. Now, moving on to the next stage, T2 hepatitis. In addition to the accumulation of excess fat, inflammation occurs in the liver. The subsequent stage is fibrosis, where persistent inflammation leads to scarring. However, the liver can usually maintain its functionality. The final, irreversible stage is cirrhosis, where extensive scarring impairs the liver's function significantly. This represents the most severe phase and is irreversible. Therefore, intervention before reaching this third stage enables the reversal of the disease, allowing individuals to lead a healthy, normal life thereafter. Before delving into treatment options, let's explore the signs and symptoms associated with fatty liver. These may include abdominal pain, decreased appetite, abdominal swelling due to fluid retention, weight loss, fatigue, muscle wasting, nausea, confusion, yellowing of the skin, jaundice, easy bruising or bleeding, spider angiomas, clusters of blood vessels under the skin, breast enlargement in men, dark urine, pale stools, and swelling in the legs. Next, we'll examine the available treatment options and strategies for preventing fatty liver disease. The cornerstone of managing fatty liver is weight loss, as excess weight is a primary contributor to the disease. Aim to shed at least 10% of your body weight, and do so gradually. Rapid weight loss should be avoided, as it can lead to increased fat deposition in the liver, achieving the opposite effect. The recommended rate of weight loss is between 0.5 to 1 kg per week. Therefore, focus on losing weight steadily and gradually. Another crucial step is to abstain from alcohol consumption. Alcohol is metabolized in the liver, which can lead to injury and inflammation, further exacerbating liver damage. It's essential to completely avoid alcohol to protect your liver health. According to multiple studies, individuals who consume coffee regularly experience a notable decrease in the risk of developing non-alcoholic fatty liver disease. Moreover, the likelihood of liver fibrosis is lower among regular coffee drinkers. Consuming 3 cups of coffee per day has been shown to potentially reverse or alleviate symptoms associated with fatty liver disease. Vitamin E functions as an antioxidant, aiding in the reduction of liver inflammation and excess fat. However, it's important to note that excessive intake of vitamin E can be detrimental to our health, given its status as a fat-soluble vitamin. The recommended dosage is 800 units per day, but consulting your doctor before taking any supplements is advisable. Exercise plays a crucial role in treating fatty liver. Activities such as running, swimming, and weightlifting can aid in reversing the condition. Vitamin D might also prove beneficial in slowing down the progression of the disease. Deficiency in vitamin D is linked with fat accumulation and exacerbation of liver inflammation. The Mediterranean diet proves highly effective in treating fatty liver disease. It incorporates olive oil, rich in monounsaturated fatty acids. Consumption of monounsaturated fats, such as those found in olive oil, is linked with beneficial effects on cholesterol, triglyceride, and blood sugar levels, as well as waist circumference. It also encompasses fish such as salmon, mackerel, and tuna, which are abundant sources of omega-3 fatty acids. These fatty acids are known to reduce the risk of non-alcoholic fatty liver disease. It incorporates whole grains, fruits, and vegetables, which aid in lowering the risk of developing non-alcoholic fatty liver disease. A low level of potassium is closely linked to the prevalence of non-alcoholic fatty liver disease. You can boost your potassium intake by incorporating fruits such as bananas, kiwis, and sweet potatoes into your diet. Additionally, consuming choline is essential for reversing fatty liver disease. The liver is the primary site for choline metabolism. Choline can be sourced from a variety of foods including beef, beef liver, egg yolks, chicken breast, fish, shiitake mushrooms, potatoes, legumes, milk, yogurt, cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and sunflower seeds. If you enjoyed watching this video, don't forget to like, subscribe, and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.